Welcome. Sorry that we're a little late today. We had a few technical difficulties, but welcome to the COVID313 Coalition for Families and Students. I'm excited to be here with you again today. My name is Christine Bell. I'm honored to serve as the Executive Director of UNI, a proud partner of this coalition, and probably most importantly, a mom of 3 really awesome kids. One that is potty training. So if you have any suggestions, please put them in the chat. And speaking of that, this is a two-way conversation and we want to hear from you. So please share your questions and comments in the chat on Facebook. And just to make sure that our folks that are monitoring, Brooke, Lindsay, Amy, are there ready and waiting for you. Let us know how you heard about today's town hall and what are you interested in learning about today? Like always, we're translating the town hall to Spanish and ASL, so we want to give folks time to get to the right place and get comfortable. Ophelia, can you please give us the details on how to listen to the Spanish interpretation?
Thank you. Muchísimas gracias. Si gustas ver este video en español, por favor síganos en Detroit Hispanic Development Corporation. Estamos en vivo al momento con transmisión de este video y también pueden buscar el link en el chat que tenemos. La traducción sería hecho hoy por Cristina Ruiz Manzón y yo, Ofelia Torres. Muchas gracias.
Thank you so much, Ophelia, and it's good to see you today. And I believe that Julie is going to start us off today in ASL interpretation. So can you please share those instructions? Oh, Katie, yeah, Katie, share those instructions. It's good to see you today. Thank you so much, Katie. Stay with us for the next 60 minutes or so that you can stay informed and empowered. And we have a collection of experts to share their knowledge in a variety of areas with you and answer some of your common questions. And remember, this is a time for you to ask your questions or share your comments with us. So please use the chat on Facebook. Again, Brooke, Lindsay, and Amy are waiting to hear from you. We'll have question and answer after most segments, and all the questions that are asked today will be posted on onedetroitpbs.org. If for some reason we can't answer a question, we're committed to getting you the answers by early next week. And those questions and answers will also be posted on onedetroitpbs.org. For our guest experts, please remember to speak slowly for our translators. They want to make sure that they're translating the important information that you're sharing correctly. Also remember to turn off your cameras when you're not speaking so our ASL interpreter can be seen, and mute yourself when you're not speaking as well. The best timekeeper in Michigan, Terry Whitfield, is with us again today, and he will chat you your remaining time. So make sure you're keeping the eye on the chat feature. If you go over your time, Rajeshri, Jametta, or myself, all the moderators, will pop onto the screen and gently remind you to wrap up. So to get us started today, we have Miss Jametta Lilly, who is at an amazing event for her organization, but she has taken the time out to be with us today. So Jametta.
Yes. Well, I always have to take time out for this because I am, number one, I am blessed to serve as the CEO of the Detroit Parent Network. I am a nana of some awesome grandbabies that are too far away in Dallas, Texas, but I'm also a proud member of this coalition that has consistently now for almost 15 months continued to bring you information and trusted resources about health, education, basic needs, and so important, social justice. And we're really pleased with the program that we have today. But speaking of social justice, one of the issues that is so critical for our families and in fact all of the nation is the quality and equity of our educational system. One of the things that many of you have been hearing about is that the new administration, the new Biden administration, has released billions of dollars to the states to assure that those children who have been so adversely impacted by COVID, health systems, small businesses, that there are funds now available to assist organizations to work their way back to being on their feet. Well, when it comes to our babies and it comes to our the unfinished learning that has occurred, our social and emotional health, that's not just going to be a push of a button. But we have opportunities, families, and we need your voice to help make some things happen. So as many of you have been hearing us discuss now for weeks and been reading about, et cetera, is that there are billions of dollars literally sitting in Lansing that requires engagement and deliberation between our governor as well as our legislators. But part of this also is important, that we want to let you know that you need to weigh in your voice. Because one of the things we've seen consistently is that the funds are not distributed generally in an equitable way, meaning that there are more dollars coming to communities like Detroit, like Flint, and places that have not had the benefit of equitable funding. So how can you make a difference? You can make a difference by contacting your legislators. You can also have the opportunity to dive in on something that all of us with the coalition believe that you will believe in too. And that is that we know our phenomenal schools cannot do everything for our families. It's going to take community-based organizations working with our schools to assure that our children have additional places to continue to not only learn, but to grow, to rediscover the joy of learning, to rediscover each other, because we have been masked up and away from each other. So how can we do that, families? We are advocating for increases, to increase specifically funding for what we call after school or out of school time. With this new opportunity, we are asking that the state and also that our mayor, yes, Mayor Duggan, set aside significant dollars, as in millions of dollars, to create an out of school time fund. And that out of school time fund would be collaborative. It would not be just the city or not be just the state or just the health department. It would be a collaboration. You have on front of you right now an opportunity to let our mayor know that you would like to participate in the many community-based hearings that he is going all throughout the city of Detroit, as literally as we speak. There is some $400 million that's been allocated to the city of Detroit. What we are advocating for is not only those dollars help support the recreation department, which is so important for the health and fitness of our community, as well as our senior citizens, but again, that there is a creation of an out of school time fund that is a collaborative effort. So you see, here's a document that we'd love for you to share. And to make sure that your voices are heard. And is it possible if we could go to another visual that we have, and that's where parents can specifically ask again for the after school partnership. There is a state level after school partnership that's all about working with organizations like Detroit Parent Network, the Youth Development Resource Center, and also you and I and many others, PAL, etc. Organizations that you know make a difference for your kids. So let's get your voices heard. Make sure that you're doing three things, that you are using the information that's in this chat to make sure your voice is being heard about having quality after school and summer programming. Make sure that you are getting your name on the list to attend some of the mayor's planning groups. And I think I can say this, we here at 313, the COVID Community Coalition, we are going to be extending an invitation to our mayor to come hear you families, to hear what you believe should be done with that 400 million and what is the value of having in every single neighborhood in the city of Detroit where you and your children can walk to a place to have quality after school learning opportunities for you as a parent to gain additional skills so that you can be a champion for your children. Because when our parents are champions for their children, our children will soar. So that's our advocacy. And it's up to you, Detroit, to help make that difference. Thank you. So we're going to transition in our discussion. As you know, we've done advocacy, and we always have to talk absolutely about health. And really so very pleased to have join us. We have a representative from our new health director, Director Hertel's office. Megan Groen is joining us to give us some updates. Many of you, we've been hearing that there are new policies at the state level, some of which are in play now, some of which are projected for July. I would love it, Megan, if you could come on and so our audience can see you. Welcome.
Thank you so much. Very excited to be here today.
Well, we're excited to have you because one of the things that's important to us is that we want the community to know that not only do we have an awesome Detroit Health Department, but we have in the state of Michigan a nationally recognized leadership team in Governor Whitmer, and in particular with our Chief Health Officer, Dr. Jonae Caldoon, which, by the way, she's from Detroit. And so we're really, I had to get that plug in. But Megan, help us get a handle on what are some of the most recent policies that have come from the state that we should be aware of, and what does it mean when we hear terms like getting back to normal? If you could speak to that, please.
Yeah, absolutely. So, really excited to talk about this topic because we keep hearing back to normal. We keep being, excited about what that means. I think as, a lot of us are excited for our kids to be getting back out, for ourselves to be getting back out, for those activities to return. But how do we do it safely? How do we make sure, we understand the pandemic is not over, but we're starting to see that other side. And so we're really excited at the health department to be looking at a lot of the policies that we've put out as orders, as executive orders or academic orders, about requiring face masks, requiring certain capacity limitations, those types of things. We are starting to put a lot more forward as recommendations, so that people will understand what will keep folks safe in school, what will keep a residential gathering, how will we make sure that we keep folks safe that are in vulnerable populations. But then also there's the side of, what am I now able to do that I wasn't able to do before? And I'm happy to kind of go into a little bit of what happened on June 1st and then what's going to happen in July as well, if that's helpful.
Megan, go ahead and give us a little bit of what happened June 1st and now what do we anticipate?
Yeah, so beginning in June, the Department of Health and Human Services issued an order that there are no longer capacity limits or mask requirements outdoors. We know that it is much safer to do activities outdoors than it is indoors. Transmission is much less likely for someone to get COVID, right? So it also happened to be around the time of year in Michigan where it's a lot nicer to go outside and do those activities, right? Start, doing some of those outdoor sports, going for walks, doing things that weren't as much options, right? Outdoor dining in December is really hard, but it's a lot more fun in June, right? So a lot of things happen in the world that made June a great place to be in the state of Michigan. So there's no longer any capacity limits and there's no longer face mask requirements. That doesn't mean if you're not fully vaccinated yet, that doesn't mean that all activities are completely safe. There's times where you're maybe in a very large crowd of people, when people are close together, maybe an outdoor sporting event, somewhere where there's, a couple thousand people. While you're not required to wear a face mask in the state of Michigan at that point in time, I can tell you, I just went out with my kids. We were around a lot of people this weekend, which was really great and exciting. But unfortunately, they're all under the age of 12. So they were all wearing a face mask outdoors when we were, in that big group of people. Now, was that, legally required? No, but, we all know what that, when there's a lot of people around, that's when the risk goes up.
Right.
And then, so we used to have these requirements around residential gatherings, right? So like how many people you should have in your house, that type of thing, how many people you should have in your backyard for, for a cookout. We still recommend that people be cautious, especially when folks are unvaccinated. But then again, we're not going to order anything at the state level about how many people you can have in your home anymore. So those all went away in June. Now, if you're indoors at, let's say, a restaurant, a movie theater, maybe you're planning an indoor wedding or a conference, all those types of establishments through the month of June, we still do have some limitations on in Michigan. So those are going to be either 50% capacity, so about half the people that you would normally have in there is how many you're going to have. We have, if there's no fire marshal, it's 30 people per 1,000, but like just when you're walking into a room, about half the people that you would normally want to see in there. There are some provisions if you have a really small store, something like that, there can always be 25 people. So if you own, a really tiny boutique, and you can really only have your employee and like 2 other people, we made some exceptions for that. We still appreciate if, people use caution, the more you're staying 6 feet away from other individuals, the safer you're gonna be. But that's what the state requires. And so when you're indoors, if you're not fully vaccinated, you still need to be wearing a mask. If you're fully vaccinated.
I'm sorry, could you repeat that one? Because I think
sure
in
can.
a lot of the discussions, people just hear things are open. If you could repeat that last statement about being inside, please.
Okay. When you're inside, if you have not yet been fully vaccinated, so you haven't gone through the whole, whether it's, 1 shot or 2 shots, whatever your regimen is, if you're not there yet, you still need to be wearing a mask. And that's for your own safety, and for everyone around you too, right? So masks are protecting you from being exposed to COVID, as well as the people that are around you, because you could be carrying it and not know. We do have people who don't have symptoms. So that piece, while you're indoors, is still in effect in Michigan until July 1st.
Got it.
And then on July 1st, there's businesses that might want to go ahead and keep that face mask requirement. There is certain places, actually in public transportation, the federal government requires you to have a face mask if you're indoors. So if you're on a bus or a train, that type of thing, you do need to continue to wear that on July 1st. But these big, broad thing where everywhere indoors, you got to wear a mask if you're not yet vaccinated, that's going away on July 1st. Uh-oh, I lost you there for a minute. I can't hear you.
Tomato, we lost you. We can't hear you. So I will
Can you hear me now?
Sure can. There we go.
I can.
Oh, it's technology. I didn't touch, I feel like a little kid. I didn't do it. I didn't touch anything. But yes, if you could distinguish, the most important factor is the vaccinations. So people who have not been vaccinated, I believe, Megan, and then what I want to do is, Christine, I do want to hand it over to you because I know you've got questions that have been coming in through the chat. And then so I'll go silent and let you pick it up from there. But as I look at some of the other information, Megan, roughly statewide, we're at what level? About 70% or near 70% vaccinations?
Unfortunately, we're only at sorry, my dog is just going crazy out there. So for first round, so after the first vaccine, for people over 16, we're at 60.4% in the state of Michigan.
Okay.
We're a little lower if you include those 12 to 15-year-olds, but you know, they haven't had quite as much time to get vaccinated. We've still got a lot of clinics going on through the schools and those types of things. So that population, we're keeping them separate for now when we look at that. So we're at about 60.4%. The president's come out and said he wants everyone at 70%. The governor, that's our goal in Michigan, as soon as possible. Yeah. And we're getting there. It slowed down a little bit in terms of, the population, the number of people that were willing to go to Ford Field, and had that, could do that and get right in there. We got a lot of people vaccinated through that, but now we've got some additional
not
challenges.
to mention TCF. Yeah.
And TCF, yes.
So Detroit has the benefit of several things. We've had TCF, which our mayor got going with the Detroit Health Department. We have the benefit of mobile units, the first one being Wayne Health, and now there are more. So I just want to make this emphasis, and please feel free to jump in. And then Christine, if you would take it. So you mentioned CDC. So this is just a reminder to our community. There is data and statements that are made at the federal level because you're looking at all the states. And then what our team does, and I'm calling it our team, our health team at the state level, you make decisions and make the statements across all the counties and all the cities and states. And what we're going to hear when our own Detroit Health Department talks about is that our vaccination rate is much lower. So that really means that we have to be much more cautious and continue to follow the masking protocols that have been, established. So I just want to, because I saw a couple people say, "Oh, we can do this now." Well, no, there's federal data, there's what's being stated at the state level, but all of us, and Megan, you should know this about us. We believe in giving the community the knowledge because knowledge is power. And so we want to be a vehicle for people powerfully protecting themselves. So please hang on. We've got some more questions for you. Christine?
Thanks, Jametta. We do have some questions. Welcome, Megan. It's so great to have you here. So one of the questions that's come in from the audience is, can businesses require customers to wear masks after July 1st?
Absolutely. And I think you're going to see a lot of businesses that, their clientele wants that. They want to see that. And just as Jametta was just talking about, we have different vaccination rates all over the state, all over the country, right? So the president talks about 70% in the country, and that's what we want. But you got to really look when you're assessing your risk about when you go in a place. You really got to think about what's happening right there in that specific community. And unfortunately, the rates in Detroit are a little bit lower than they are in other places. So you might have some businesses that want to do that. Nobody wants to have a business that has an outbreak of folks that are associated with it either. So they want to protect their business and they want to protect their clients too. So I think you're going to see that across the state, but it will be their decision.
What would happen if we see another surge? Would restrictions come back in place?
I think that's a great question. So there's three things we really look at, which are the case rates. So just how many cases of COVID are out there, right? And then the percent positivity, which shows us if we're capturing it all in terms of the community spread, if we even know what's going on out there. And then how many people are hospitalized. And so if those three indicators go up, and they've been going down for the last Well, 8 weeks for the first 2, 6 weeks for hospitalizations lags a little bit, right? Because it takes a little longer. Once people get sick, then they need to go to the hospital. So we have seen, tremendous drops over the last several weeks, but things can happen. There could be a variant that's just a little bit different, that's unanticipated. So of course, restrictions could come back. Is that something that we're seeing right now? No. Because we have seen those numbers continue to go down. But it is always something that, we will protect the public health if we need to.
So Megan, you talked about the 3 indicators, and the positivity rate is somewhat reliant on the testing rate. And so is the state seeing a drop in testing? And is that due to the vaccination rate?
Right. I mean, they kind of all go together, right? So I say the 3 because that's what we've been talking about for the last year and a half. But there's 4, right? Like I'm missing one there. There's vaccination. And so we wouldn't anticipate, well, if you're symptomatic, something like that, and going to be interacting with people who are unvaccinated, you're going to want to get a test. Make sure because we have seen some transmission with folks who are vaccinated. Very small, though. But that is a very real thing that can happen. So those testing numbers, you're right, have gone down, but that's why you look at the 2 of those together. So if you have a huge number of cases, but your percent positivity is like very high, it probably means you're not testing enough people. You're not capturing it all. If it's low, that means you're probably getting a pretty good sampling. Now vaccination is another thing. It probably means we need to test less people, right? But we're still learning in that space, but we have seen those testing numbers go down. You're correct.
So you said something in that I think is really important that I want to draw out, and it was I think there's been a question of, can you shed the virus if you're vaccinated? We know you can still get the virus if you've been vaccinated. You may not get as sick, but you can still get it. So what data do you all have at the state level that can give us any indication of whether or not you can shed the virus and give it to another person when you're vaccinated? You said the number was really low. I think that's what I heard you said. So I just want to follow up on that.
It is very low. And I wish I had it off the top of my head. But I can definitely follow up with you all on that, as well as, maybe even, one of our doctors can work with you in some of those specific questions too. But we are looking at a pretty low number there, but it is still possible. And it is something that is happening. And so you can have it and you can transmit it. That is still something, although, even if you're looking at a couple percentage points, when you're looking at a lot of people, right, that can still be a significant thing that's happening. So we just still do need to be pretty careful.
Okay. And there have been some other variants that have been reported. The Delta variant is the most recent that we've heard about. Can you shed any sort of light on the variants and if there's anything we need to know, anything that that you think the rest of us should know?
So I think the most important thing to know about the variants right now, yes, you're right. There's a couple of them out there. There's Alpha, there's Delta, there's, these things that are happening in the world, right? And I'm glad that we've changed the names because they have these really scary numbers next to them and all of these things that to me were very intimidating. But I think the most important thing you need to know is that what we found out so far is the vaccine is incredibly effective against them. And so we didn't know that coming in, right? And could that change in the future? Sure. But the vaccines we have right now are very effective against the variants that we're seeing. And so that's something that gives us a lot of hope that we really are getting back to normal.
Megan, it has been wonderful to have you here. It's so important, I think, that the state is with us and talking with us. And thank you so much for your hard work in the last 15 months. I know that the folks that have been dealing directly with this pandemic, our health workers, our public health agencies have been working overtime. So thank you so much. And we are going to move to Hannah at the health department. So thank you so much, Megan.
Yes, thank you for having me.
All right. So like always, we have our Detroit Health Department here represented by Hannah. And so Hannah, I'm going to let you take it away with your presentation. So go ahead.
And that was a really great opening for us because we had some of those nitty-gritty stuff that she covers. So we're going to actually talk about one of our really new programs I'm super excited to bring to you all. But as always, we're going to start with an update of what's happening in the city of Detroit. And today was a pretty exciting day for me because for the first time in a long time, Detroit reached 2.9% positivity, which means we are below the 3% threshold, which is where we consider community spread. So this is a big benchmark from us. And it means that Detroiters are getting vaccinated and they're still following those really good public health guidelines, like wearing a mask if you're not fully vaccinated, continuing to practice socially distancing, and isolating yourself if you are symptomatic or you're unvaccinated and you've been exposed to someone who has a COVID-19 infection. If you look at the city of Detroit in comparison to the state of Michigan, we still, however, are at a higher percent positivity. If you look to our neighbors in Washington County, they're at 0.7%. Oakland County to the north is at 1.8%. St. Clair is at 3.1%. So all of these trends are showing a downtrend. We are still continuing to have confirmed cases at 51,206 confirmed cases in the city of Detroit, as well as 2,244 confirmed deaths. So COVID, while the numbers are going down, it's still very much a threat to our community, and we still need to stay vigilant and make sure that we're getting vaccinated if that's something that we think is right for our families. So as we talked about earlier, the city of Detroit has a lower percent vaccination rate in comparison to the state of Michigan. Detroit has about 35.6% of all Detroiters who are eligible who have received at least one dose of the vaccine. This trails behind our neighbors in Macomb, Oakland, Outer Wayne, and Washington County, as well as the state of Michigan. We are making an effort through the city of Detroit to have an equitable access, and we're going to talk about some of the ways that we are expanding our programs. So we're making sure that we're reaching every single Detroiter who wants a vaccine, no matter what their status is, whether it's economically or their disability. So as a review, we think it's really important to talk about the differences of the vaccines and make sure that people have the information they need to make an informed decision. So the Pfizer and the Moderna vaccine are both the messenger mRNA vaccines, and those are a 2-dose series with about a 95% efficacy, and you are considered fully vaccinated 14 days after your second dose of the vaccine. These vaccines also have about 100% chance at preventing you from death from COVID-19, which is exactly what we're looking for in a public health vaccination. The Johnson & Johnson vaccine is a viral vector platform. I like to think of it as a cousin because they all work to produce the COVID-19 spike protein, which isn't live virus, just a little piece of it that teaches our body how to protect itself from COVID-19. If you're someone who's scared of needles or have a busy schedule, the Johnson & Johnson vaccine is a one-shot vaccine, so it may be the right vaccine for you as well. And it also has a 70% efficacy profile, which is really important to note, though, that you can't compare apples to oranges because these clinical trials were done at different times, and the Johnson & Johnson trials took place when we were having a spike in the pandemic, so there was a lot more community spread and new, more infectious variants. You are considered fully vaccinated 14 days after your single dose of the Johnson & Johnson vaccine. And as always, all these vaccines are offered free of charge to all people living and working in the United States, regardless of your immigration or health insurance status. And to make an appointment, give us a call at 313-230-0505, Monday through Friday from 9 a.m. to 6 p.m. We're vaccinating anyone over the age of 12 and up, And for 12 to 17, you will be getting the Pfizer vaccine. Also important to note that if you fall between the 12 and 17 age group, you must be accompanied by a parent or guardian, and they must show their ID on your vaccination appointment, and they must also sign a written consent form. There is still no good neighbor reimbursement for anyone bringing a person under the age of 18 to get vaccinated. However, we still are running that program in the city. You may also see us on your block throughout the summer at one of our pop-up locations, and these are 3 of our locations today. So if any one of these is in your neighborhood, come by and get your vaccine if you haven't yet, and we will be happy to give you that. And here is a new program that was recently announced from the health department. It's one of our ways that we're going to be reaching our homebound residents who can't get to one of the vaccine sites. So let's talk about what this program is. Starting June 14th, the city of Detroit will be vaccinating homebound residents who are not able to go to the various vaccination locations across the city. The Detroit Health Department will contact residents as of yesterday through a list from the state of Michigan. If you are not on that list or you want to be included in this list and you fall into that category, you can always give us a call too, and we will connect you so that you can get the service to your home if you qualify. The Homebound program is a partnership with the Detroit Area of Aging, Wayne Health, Maternal Infant Health Programs, and the Michigan Department of Health and Human Services. It's important to note too that we have over 150 teams, and the teams will be registered nurses who come in uniform and have an ID to make sure that we are the health department and that we are there to give you a vaccine. This program is expected to last in November or December. And we'll be offering the Johnson vaccine or the Pfizer vaccine. So you have, and we did a wonderful job covering those guidelines. So I'm going to skip through them and pop up.
Anna, can you mute?
It's actually Wes. Can you mute, please? We can hear your shuffling of the papers. And Jametta, actually, there are 2 people that are off mute. Thanks so much. All right, Hannah, keep going.
Oh, that was the end. So we're just having.
Oh, that was the end. Okay, great. Great. And then Molly, could you mute Jametta? She might not be able to mute herself. Okay. So Hannah, thank you so much for being here. Do you have an update for us on the rec department, the parks and rec departments as it relates to when they might be opening, or just any what they are planning now that restrictions have been lifted?
So I know they're starting to open some of their summer camps, I believe. I checked on their website this morning, so that's a positive direction. And then we're going to give updates too as we see what the formal recommendations are for the city as well.
Okay, thank you. And then has the city considered additional incentives? It's really wonderful that you all have started a new program where you're going to go to folks that are homebound. Are there any other incentive type programs that you all are thinking through and you see coming in the future?
Not from where I'm standing. We still have the Good Neighbor program going too as an incentive, but we want to make sure that people feel like they don't, they're making their decision to get vaccinated and they're not being bribed to do so. So we're working really hard to get people education and make sure that they feel comfortable in their decision to get vaccinated. That's our number one goal.
So Hannah, as you talk about not, making sure that people can make their own decisions, has the health department started to use some strategies, let me frame that differently. What strategies is the health department using for folks that are vaccine hesitant or are really vaccine resistant?
That's a great question. So what we're doing is we're making sure that we have an open dialogue with our communities. And so this we have the ability for anyone to request information on the vaccine, no matter how they stand or what they believe. We have a call-in line where people can call us from 8 a.m. to 6 p.m. Monday through Friday through the health department and speak with one of our nurses. You may call and get me one day because that's part of my role. And we are offering these mobile clinics so that if you see these clinics in your community and you're hesitant, come up to talk to us and have a conversation about, getting vaccinated. Or if you see your neighbor getting vaccinated, ask them why. That can be a really good way for you to get information. And just, we're always here for our community.
Great. And then I want to ask you the same question from our audience that was asked to the state. What happens if there's another surge? Because our vaccination rates across the city are quite low. So what happens if we have another surge?
So there could potentially be, more guidelines from the state and, at the local level as well. They can enforce that. But as of now, we are following the state and their guidance to make sure that we can get Detroit back to being Detroit. We always say too that just be prepared. The thing is, we've been dealing with this for over a year now. So we have had many dress rehearsals. And if we need to go, back a step so that we can go 2 steps forward in the future, just keep an open mind and be patient, and we will get there eventually.
And then, what would you recommend with our vaccination rate being where it's at? What would you recommend businesses do around mask policy?
I would say have an open conversation with their employees. You never know. Some employees are very private. Ask, how do you feel about people coming in and not necessarily knowing what their vaccination status is? It's completely fine to ask your patrons to wear a mask when they're in your facility. You're protecting your staff so that they can be there to do their jobs and, keep our community businesses running, and just have that open conversation. What we found in areas that we have outbreaks is that what usually can cause it is a lapse in communication. So if your business plans ahead to have a conversation, if there's an outbreak or something like that, that's going to set our city forward to make sure that we can stop the spread of COVID-19 and keep our wonderful businesses open.
Great. And then the last question, Hannah, today is, will we have to get a booster shot? When will we know? So what's the data telling us?
So the data is saying at least 6 months, and we're still waiting on that 9-month data. There are potentials for booster shots in the future. We don't know when exactly they're going to come out. The good thing is that the way that these vaccines are designed with the mRNA technology, it's a very easy vaccine to edit so that we can get a booster with the different variant spike proteins so that our body can recognize COVID-19. But there's no formal plan in place, and we will do our best to keep our community updated day to day by when and if there is a booster shot available.
So Hannah, I just want to make sure that I understand. So I got my vaccination in, I think it was April. We'll say April. So does that mean I need to get vaccinated again?
As of
May,
now,
June,
no.
July, August. Okay. So I don't need to get vaccinated again in 6 months.
And I like to say the data is showing at least, which means that the participants who are participating in the study, that's a mouthful, had very high antibody and what we call memory T cell levels to make so that they still had really good protection at that 6-month mark. So people are saying, oh, it's only good for 6 months, but what the data is showing is that it is good for at least 6 months and very likely much longer. So we're waiting for that 9-month data to come out, because I got my second shot was January 11th. So I'm almost at 6 months now. So I'm waiting for that for myself too.
Yeah. Okay, great. Well, Hannah, like always, we love to have you here, and thank you so much for giving us the most up-to-date information on where we're at in the city. We really appreciate it. And I am going to pass it now to Rajeshri to introduce our next guest. So thanks, Hannah. Rajeshri.
Hi there, everyone. It is my pleasure to welcome Denise Smith. Denise, can I ask you to turn on your camera and your microphone? Denise, is that you joining us by phone?
This is Marissa.
Denise, are you on? Maybe Denise is taking a few moments.
Well, Rajeshri, why let's go in the reverse. So we're going to start with early childcare, but let's try, or childhood, not childcare. Let's start with K-12 schools and charter schools, and you're our guest for today. So, do you want to share sort of a state of the state of or this maybe not that serious, but could you share with us what is going on with charter schools right now as we're ending the school year, wrapping up the school year, and entering into summer and planning for next year?
Absolutely.
Thanks.
Thank you for the opportunity to share about what's happening in the wonderful charter schools in the city. Much like all schools around the state, school is wrapping up. It's been a challenging year for everyone, in particular for the principals, the teachers, and especially the students and families. And so first and foremost, we just want to say thank you to everyone for sticking with it this year and giving it your best. We know that this was challenging, and we are looking forward to concluding this year and putting our thoughts onto the next year. For most schools, planning is underway in ways that, this is always a season to plan, but definitely the planning is at full speed right now, just based on what we've been through the last 18 months. We're looking forward to welcoming students back in the fall, and are really scouring data to just make decisions on how best to meet their needs, because we know that this last 18 months has had impact on students, families, teachers, everyone. So we're trying to just figure out how we're going to best meet their needs. And so you've got teachers and schools really evaluating information that they have in front of them. We know that taking tests this last spring was a challenge, and for some students, it didn't happen, and that's okay. So let me reassure families that for those of you who were not able to get the children in to take tests, the M-STEP, et cetera, it's okay. We are managing without that information. And for those of you who were able to get your kids in, we appreciate it. And that information is helping us as well. And so we're using whatever information is available to us to help plan for a strong start in the fall. Many of the schools are offering summer programming. And so if you're curious about whether your school is or not, I would suggest calling the school and asking them. And if they are not offering it, they would be able to probably give you some recommendations as to where to go. There will be a couple of summer school and out of school programs offered this summer specifically for charter school students. So please be on the lookout for information about those in the next week or so. And finally, as you all know, we talked about last week, there is significant funding that is coming to schools to help schools recover from this pandemic. And the process by which schools are determining how best to use those funds is very similar throughout the different charter schools. But in general, it involves obviously a review of information and a good hard look at what are the big barriers to success in terms of the school and the students. And so schools are looking to invest in whatever they feel is most going to be most beneficial to the students. It happens at a board level. So the schools may come up with the suggestions, but it's actually a board decision on how to allocate the funds. All board meetings are open and public. So we do recommend and suggest that parents attend those so that you can hear the discussion for your particular school. And it varies. Some schools are using the funds to make infrastructure repairs, building repairs, that kind of thing, because they feel like that's kind of what's best to meet the needs of students. Others may not have that need and are looking into really attacking pandemic learning loss. Still others are looking to support teachers with professional development and other resources. And so it very much varies. But I can tell you that every conversation I have had with schools and boards that are considering this, the first and foremost consideration has been, what do our students need? What do we see that our students need? What do our teachers say our students need? What do the parents say our students need? It is all about student needs and finding ways to best meet those needs so that we can best set them up for their best success as we come back in the fall. So this biggest piece of advice I can give you as you wrap up the school year is take a moment to celebrate and congratulate yourself on making it through. We would say that in any year, but particularly this one. Ensure that you are enrolled in your school of choice for next year, whatever that may be. Being enrolled allows your school to plan for you better. And again, in this coming year, it's really super important that, you know, we can get as much that we can plan for as much as we can ahead of time, because as we know, things happen that we don't plan for. So if we've got more planned, we are better prepared to deal with the things that we can't predict. And we want to make sure every student has been accounted for. So if you haven't enrolled yet, please choose your school, please ensure you're enrolled, and so that you know and have your destination for the fall. And lastly, you know, there's never too much reading. So if you can spend some time this summer, enjoy being outside, enjoying being with people and with families, especially after the years that we've had, but take a little time each week and each day to read a little, because that's the single biggest activity that one can do to help improve their own performance as we go forward. So I don't know if there's any questions, but that's what I have. And congratulations on finishing the school year.
Rajeshri, I think we weren't able to give the numbers, but could you share what the stimulus money, what is the dollar amount? What does that mean? Like, what's the dollar amount that each student
It varies. It honestly
okay.
varies school to school. I think if we look at DPSCD, it's somewhere at like $16,000 a student. Charter schools, I have seen it vary from $800 a student all the way up to maybe $4,000 a student. And, you know, while that seems inequitable, and it is, it's important to note that those numbers are based on a federal formula that, to be honest, at this point, the state doesn't have any control over. So we believe in, you know, obviously we want to see equitable funding. We also recognize that it is something that it is determined by a predetermined formula that doesn't have a lot of wiggle room at the moment. So, you know, we encourage, again, parents to be aware of that, but also recognize where it comes from.
But it is significant. These are significant dollars that can really help students. And there are charter schools thinking through this as you know, because this is one-time funding, so this isn't a change, and so the $800 doesn't stay from now until, you know, your child graduates. This is for 3 years, correct? And so are you finding that charter schools are really trying to make decisions about what's best for students in the context of sort of one-time money?
Yeah, I think that's the challenge, right? We recognize that whatever we put out there, we want to make sure that it's sustainable over time. And so that's a lot of the discussion. That said, there's also some immediate needs that we know we're going to have in the fall. So I feel like that's been a really good balanced conversation, and whatever the decisions are being made, there is a recognition that this is not continued funding. So whatever plans are being made, it's with that in mind. So yeah, I think that the schools, you know, charter schools in general have always had to be very transparent and very frugal with their funding. You know, the funding is always sort of needs to be stretched as much as possible. So I don't think that philosophy has changed in any way, shape, or form, despite the fact that there's been this, you know, additional welcomed funding that's come into the mix.
Thank you so much, Rajeshri. And now I am going to let you and Denise take it away. Denise, It is lovely to see you. This is Denise Smith from Hope Starts Here, and looking beautiful as always. And so Rajeshri is gonna chat with you now, and I am gonna go off camera. Thank you, Rajeshri. Welcome, Denise.
Thank you so much.
Hey, Denise, good to see you.
Always good to see you as well.
Welcome. Well, you know, Denise, we are going to jump right into the questions. Big news on the early childhood front in these last couple of days. Can you summarize for us kind of what has happened and what it means?
Sure. Well, there is an exciting time in the early childhood space, one that for my 27 years I haven't seen in terms of, the financing and investment here. There have been a couple of announcements, which I'll share, but just to put it all in context, all of the states have received funds under this American Relief Plan. And in doing so, there were specific allocations for the early childhood space. In fact, because of the money that was left over from our CARES Relief Fund, that we're looking at an investment of $1.4 billion. 700 of that is intended to stabilize the early childhood workforce. This is not only important for the children who are accessing these programs, but clearly it's become very evident to the larger community that is also important for our economy in order for folks who have families who have young children to be able to go back to work and to school. And so what does that mean? A number of things. So earlier this week, in fact, one of the uses for those funds was announced by the governor in terms of her plan to expand Great Start Readiness to ensure all eligible children have access. And Great Start Readiness is our state-run program for 4-year-olds. Right now, only 66% of eligible children statewide can receive a GSRP, and that leaves a gap of around 22,000 children who are eligible who can't participate if they wanted to. So the governor's proposal included a funding increase to the number of slots so that they're eventually getting to 90% of eligible children. And this also included $50 million in those federal funds to support expansion, including more classrooms, support to educators, transportation, and other supports. So our Mayor Duggan joined her in that announcement because that expansion also means 1,500 additional 4-year-old seats for the city of Detroit, what he has been pushing for the last couple of years as universal preschool. This investment is funded by those American Rescue dollars to start and transition, but afterwards will be maintained by a school aid fund. So when we think about the rest of the money, which was intended a large portion for stabilization of the workforce as advocates, because even with the governor's recommendations, it still has to get passed through the legislature, right? So we need to continue to advocate that they put this to plan. But the rest of the money meant to stabilize, as advocates, we've been asking that it does just that. We know that infant toddlers are a huge gap in service for our community. So I've asked that the base grants in the previous rounds, there were rounds of grants that went out to educators directly so that they could use to support their program, whether it's buying PPE supplies, making sure that they had equipment that was necessary. They could use it for rent. It was really meant to stabilize. This one is just as broad. We want to make sure that those programs who want and can serve infant toddlers are doing that, and they're given additional money over and above and beyond the other age groups. We also believe that there's an opportunity to make sure that these rounds of grants are delivered much more equitably than before. In the last round, there were programs who were left out, our home-based programs in particular. So here, those programs, which is really high in the city of Detroit, who are serving children families who are receiving subsidy, children who have special needs. We want to make sure that the opportunity bonuses for those programs is included and that we're addressing what we know are childcare deserts. There are 10 major high need neighborhoods in the city of Detroit where there is little to no childcare. And because transportation is also an issue, access becomes an issue for those families.
Denise, can I ask about that? Because that was one of the questions that we had with respect to centers, right? The pandemic hit many of those, particularly home-based centers, hard. Can you give us a sense of what numbers we're looking at? I mean, how many centers do you estimate are percentage-wise open today versus what was open 2 years ago before the pandemic?
Yeah, good question. We know that our open rate, and mind you, this is self-reported, but the self-reported open rate is at 60%. And that's after the COVID. At the height of COVID, clearly it was way low. It was below 40%. So we have gone up.
And how do parents find out what centers and providers are open and accepting students?
There are a number of resources. Clearly, you could go to greatstarttoquality.org. United Way also has Connect for Care. So those sources are available. The Office of Early Learning through the Commission also has a platform, Detroit Early Learning. So any of those spaces, you can search for care. You can see if that program is open. Again, there would be a self-report, but they should have reported open or closed. There'll be additional information that Hope Starts Here will be pushing out alongside its partners, particularly during the summer. You talked a little bit about this and making sure that we're helping those children who are rising kindergartners and make sure that those transition points along the way are supported. So that transition from home to early, from early to kindergarten. There'll be information that you'll see at our bus stops, at mogul stations, really providing information so that our children are ready, set, and can go forward in being successful. And we'll couple that with information to get into hands of families. I think most important right now, as you indicated, is to make sure that our legislator acts on the funds that are here and gets it into the hands of programs so that they can stabilize and grow.
Great. And in the last minute or two that we have here, can you share with us, you mentioned the rising kindergartners. What are you hearing about kindergarten? There were many families and many students who didn't elect to go to kindergarten this past year from various reasons. What are you hearing about those, 5 to 6 year olds? Are they heading off to first grade? Are they starting in kindergarten, and is it a mix? How are parents making that decision?
It is a mix. It is definitely a mix. We know that there'll need to be additional supports, which is why, some of our Head Starts and our early childhood programs are even providing those summer supports to those rising kindergartners in the event that they do not go on. They have this year that they can, in some cases, stay with those programs. But we want to make sure that they are prepared either way. Families are choosing to just skip over kindergarten. If you all don't know, Michigan does not mandate kindergarten. And so there has always been that. We want this campaign that we're pushing out this summer to really elevate the importance of all of those years so that children can be successful and we don't see the things that have been showing up for our children around reading and math proficiency at 3rd grade. Those early years are important. And we want to make sure that children get there and that they're ready.
Great. Denise, thank you so much for being on with us today. It is always a pleasure to have you, and thank you for your hard work on behalf of Detroit's youngest residents. We appreciate everything that you do.
Yeah, absolutely. My
Thank
pleasure.
you.
Thanks for having me.
Great. It is now my pleasure to introduce the team from DTE District 6. So if I could invite Julie, Monica, and Brian to please turn on your microphones and cameras, and I'm going to allow you to take it away. Welcome. Thank you for being here.
All right. Thank you for having us. We really appreciate it. And I do apologize. So I'm Julie, but we lost Monica to another meeting. And we have Brian on here, and I apologize too, because I can't see his face at the same time. There he is. Hey, Brian. Okay, so I am, and I don't know if you have our slide deck or if we're supposed to share it. But I'm the regional relations manager between the city of Detroit for DTE, and I'm between DTE and the city of Detroit, mostly the government. So that has to do with like infrastructure programs, billing issues, just getting messages out to residents, all types of coordination. So again, may I ask, should I be sharing my presentation or do you put it up? There we go.
There you go.
Okay, so again, I'm the jack of all trades. Brian is on here. He's the expert in what we're going to focus on, which is our gas main renewal program. So if you go ahead to the second slide, I'm just going to give you a quick overview, though, of all the infrastructure that's going on this year in Southwest, mainly District 6. So again, a lot going on here, but this was the only way to kind of capture the whole district. So what we're going to talk about today is actually what shows up in red. This is the gas main and service renewal and meter move out. So this is the most, of all the infrastructure that we have going on, this is probably the most intrusive because we are going all the way up and down blocks. Everybody gets a new gas service. Everybody gets a new meter, or sorry, they at least get their meter moved outside. It may be a new one, depending on how old that is. So again, that's the most substantial project that we have going on in D6. But we also, on the electric side, everywhere it's green, we're doing tree trim maintenance. Once you get your trees trimmed from the power lines, and these are just the ones in back of your house, not the service line from the back of your house to your house, that one is the responsibility of the homeowner. But once you go through a trim cycle, you will always be on a 5-year trim cycle. And so I'm here on the east side of Detroit. My neighborhood just got trimmed. It had been 12 years. So the good news is this was a pretty severe cut, but the next time we're all going to be on a 5-year cadence. So it's going to be great for the health and resilience of our circuits. 70% of power outages are caused by trees and vegetation falling on the lines. So in blue on the map, that's what we call hardening. So after you come through and you have great access to the poles, you do this really, like you check every single pole for all the components. You replace the wood cross arms with fiberglass. So it's a hardening until 20 to 30 years from now, when we're looking at a full system, like absolutely everything gets replaced. So again, hardening comes after tree trim. And then yellow, which is mostly closer to downtown, is where we have underground work and substation work. And in D6, that would mean the Corktown substation that's coming up. We do a lot of work outside of this, like spot trim when there are emergencies that aren't in the planned maintenance areas. We also do meter move out if we haven't been able to actually get a meter read or see a meter in about 7 years. That's way beyond the timeline we're supposed to for safety. We are visiting those residences and businesses to move those meters outside. So those might not just be in the red districts. Those are all over the city. All right, so going to the next slide, again, we just want to give you a little more details on what's going on in that large red area here, which is our gas main renewal program, and I'll let Brian take it from here.
Yeah, good afternoon. Yeah, the gas renewal programs all over the city. We're going to kind of highlight and talk about District 6 here. But overall, in a 15-year period, we're going to be investing about $3.5 billion across the state of Michigan. You know, we use different materials. We're taking cast iron, wrought iron, bare steel gas mains, and we're replacing them with plastic gas lines, which is new and improved and allows us to put higher pressure on the gas main that allows you know, better reliability and less we call district regulation underground, and you know, just eliminates and makes things much more efficient. It allows us to have the meters outside. In fact, requires us to have the meters outside with the increased pressure. That allows us, or more specifically fire and police, quick availability to do a gas shutoff outside the house in case there's a major emergency going on inside the house, or our employees, if they respond to the house, very easy access to get in there if there's a fire or major leak in the house. We just don't want to enter the home to fix. Meter reads won't be estimated. We put an AMI, we call it remotely reads the meters, so we don't need to get in the basement any longer, and haven't for some time now, but it allows it to be more efficient to just read the meter without having to bother any homeowner. You know, maintenance is all done outside. There's a lot of maintenance that we must do to keep everything safe with a gas meter and service line. If it's in the basement, it makes it a lot harder to access, and it's also a big inconvenience for the homeowners in a lot of cases. We're able to inspect it, we're able to leak survey it yearly, and it is just a much better system as we go through.
All right, next slide.
Next slide. You know, we are still actively engaging our employees in our COVID protocol. The only thing slightly changed from when we were in the heat of the pandemic is, you know, outdoors you may not see our employees wearing a face mask while they're performing the work. And that's because they've been vaccinated and otherwise been cleared for work with our safety screening that goes on daily. But we're very committed to making sure what's right is enforced, and we check our employees' temperature and fill out a screening form daily. If they're sick, they stay home. They're not charged sick time. So there's, no employees coming in with any types of symptoms. We encourage everyone to do the right thing and stay home. If there are symptoms identified, they are not allowed to enter our property, get in their uniform, and go out to work. We encourage our social distancing, and there's on the right hand side kind of a couple of visual aids to show how 6 feet apart is achieved. Reaching your hands together, some pylons, or our trailers are 6 feet wide. So that's kind of how we measure success with our social distancing expectation. When we enter your house, we'll be wearing our safety glasses. We will require our employees to wear their face mask entering anyone's home. We'll wear neutral gloves or other work gloves, so that if our hands are touching anything in a customer's home, that we're not contaminating anything. We do ask our customers to please respect that on your side as well. We know that there's questions. We know that there's some input that you want to have while we're performing our work. We just ask that you respect our employees' space while we're having that interaction together. Next slide.
Next, we have a map.
So this is District 6, or I call it the 4th precinct of District 6. We've been in here with our contractor Miller Pipeline for most of the year, and we are starting now with the DTE crews going door to door and moving the meters out and upgrading the service lines. It's a pretty big grid, and our next slide is going to give us the exact numbers, but just for sake of those that know the area, it's basically Lafayette north to Dix, between Central and Dix and Berner when they come together. So it's a we call it a grid, a pretty big grid. We've already done a lot of significant activity there with gas main installation. But overall, when we're completed, we're going to have 27.3 miles of new gas main and services. 3,300 service lines will be renewed. About 2,300 meters will be moved outside. What that number is telling us is 1,000 of the 3,300 are already outside. So we'll just be upgrading the services, have the gas off for a little bit. We'll be tying it into the new gas main that we're putting in at the higher pressure. So we call it an upgrade at the wall process. So there won't be any additional work inside other than turning your appliances back on when the work is done. So for those 1,000 customers, the heavy lifting of the work inside is already done, and the other 2,300 will require us to move the basement meter to the outside of the property. Big grid, 27.3 miles is a lot of miles. I believe the number is about 120 in the entire city of Detroit. So you're seeing about 30 miles of that in the 4th precinct area, District 6 there. Once all our work is done, which is when the final DTE crew leaves the street, as I said, has started as of last week. The property restoration, which is probably the most important part to all of us, is because that's what we live with now for the next 100 years. About 30 days is when you'll see all of that done between the sidewalk and the street cuts, if there's any such thing, or grass replaced with seed that will grow when we water it, or you water it and it rains and whatnot. It'll grow back nicely for you. We have good success with the grass growing through seed, so there's no worries. It's well tested, and that's how the city inspectors require us to finish that that product.
Then next we have the schedule.
So all that work that I just described, we plan on, and it's conservative, meaning, hopefully we'll be done a little bit ahead of schedule, but we build in weather days and other things that we need to do or can expect. But right at the beginning of October, we should have all the main finished up. Our service work, as I stated, I was just out with the crew yesterday on Woodmere and Burner, so they're out there working away, and they're heading from the furthest west to the east. So we've got one crew in there working already, and so they're making good progress there. We expect that work to go right up to the end of the year. In the restoration, then again, our last step will begin immediately when we leave the area. When we don't wait until we're finished with the 27 miles, we start immediately behind that crew, and in this case on Woodmere. That gets turned over to our restoration team, who goes out, documents what needs to be done. That work order gets created immediately, sent over to our restoration contractors, and then that work commences immediately. So it's right in behind. It's not wait until the end of the project and then come in and restore.
And then finally, most importantly, the number to write down.
There you go. Take a picture of it. This number goes right into my office. Our office is located on Schaefer Highway in Detroit, in the 2nd precinct, or I don't know what district that is, but we're right down the street from the 2nd precinct. It's on Schaefer, and this comes right into my staff, who will answer or return your call. As soon as we get the voicemail message, it's 313-270-9240.
Excellent. All right. Well, thank you, Brian. I think the last slide, I just have a more generic overview, because I just wanted everybody to have these numbers available that are specific, so that you aren't always calling the 800 number. But I also want to mention too, so DTE, of course, we're partnered throughout the city. And I know recently Brian's team participated with Uni and other nonprofits in doing Motor City Makeover. So thank you, Brian's team, because I know it was a hot one out there when you guys worked on that. And I wanted to just say a note, and it's on here on the bottom too. So I cover all of Detroit. Like I said, I'm sitting over here on the east side. I just went through the gas main renewal program myself. So that's why I said, I know how intrusive it is. I mean, people are digging up the earth in front of your homes. I will say it's just a matter of patience, right? Because everything does get put back together. This is a once in a lifetime, unless you move to the next neighborhood that's being done, process where, these veins have been here for 80 to 100 years. So again, just be patient. That restoration will happen. We've got that direct line if you have any questions. Grass seed, I will also say this. I know about the program. I gave mine a water. Within 5 days, I had grass coming up. I do have places of neighbors who do not water, do not touch it, some abandoned homes. After the rains, within 3 weeks, the grass is growing just like mine. So we've really got a good hardy grass seed that's going to bring you back to 100% quite quickly. So again, there's so much more I could say on the DTE part, but keep in mind, you can always reach out, especially to your council person or your Department of Neighborhoods. They have me on speed dial, and we can always come to a neighborhood block club meeting, and we can talk about what we're doing in your neighborhood. So thank you so much.
Thank you so much, Julie and Dave. We appreciate it. So giving all this great information. And maybe I need you guys to tell me what grass seed you use, because grass will not grow in my backyard. And it causes me a lot of stress. So I might be calling just to find out what the grass seed is.
But it's funny you say that, because people, the city of Detroit, DPW and General Service Department have asked for the seed. We actually don't own it. Our contractor does, but we gotta figure this out, Brian, because I'm getting a lot of requests for it.
Oh, I'm sorry. I said Dave. Brian. Yes.
Oh, Brian. Yeah,
grass
yeah.
seed. Grass seed. Get the name of the grass seed.
Right.
Well, it comes in a white bag. I was telling Julie, it comes in a white bag, and it's not like Scott's or any of that.
Yeah.
It comes with a sticker on it called utility mix, blah, blah, blah. I really don't know, but I probably got the the stroke to maybe get the patent and then just retire and sell.
Thank you. We have to.
There you go. Well, thank you guys so much
Yes.
for being with us here today. We're going to
Thank
wrap up our town hall now, but a few announcements. 482 Forward has launched a community voting tool for each school district in the state to vote on how they want school stimulus money to be spent. Please take a minute to fill out the survey. It's getting dropped in the chat right now. DHDC is hosting a redistricting event, I think in 2 weeks. And then they also have a language justice petition, but all that information is going into the chat right now. And why Jametta had to drop off is because DPN, Detroit Parent Network, was doing an amazing expo today for young inventors, and scientists and literacy. So if you have time, head on out to Eastern Market. You will find Detroit Parent Network there and some young inventors and some literacy activities. All right. And so we also wanted to share the city of Detroit, the meetings that the mayor is having. And these are being held over the next 25 days to hear what it is that residents want the $400 million that is coming to the city to be spent on. And Mayor Duggan is listening and he is keeping track. So it's really important that your voice is heard. So if you want out of school time, some of these dollars to go to out of school time, you've got to be at these meetings and let the mayor know that that is important to you. If home repair is important to you, you've got to be there to let him know. So also our council members are also having meetings. So check out your council members information. And right now we're sharing on the screen when the neighborhood meetings are. And we know that the mayor is listening. He's actually tracking what people are saying they want and what they're saying they don't want. So make your voice heard. All right. Everyone have a wonderful rest of the week and a great weekend. And there are two other things. The Wright Museum has a number of Juneteenth activities that's in and around June 19th. And then we just want to remind everybody that it's Pride Month and Black Musician Month. I challenge you all to check out all of the awesome Black musicians that came out of the city of Detroit and that still come out of the city of Detroit. All right, everyone have a great, wonderful day. Stay healthy, stay knowledgeable, stay powerful. We'll see y'all later.